Current affairs, health and diseases. Superbugs, Zika virus, Japanese encephalitis, Ebola, swine flu, bird flu. Superbugs. What is superbug? Superbug is a strain of bacteria that has become resistant to antibiotic drugs. Antibiotics is a medicine that inhibits the growth of microorganisms such as bacteria. Antimicrobial resistance means the ability of microorganisms to resist the effect of this medication or antibiotics. Microorganisms that develop antimicrobial resistance are sometimes referred to as superbugs. Antimicrobial resistance occurs naturally over time, usually through genetic changes. And the misuse and overuse of antibiotics can cause antimicrobial resistance. Antibiotics are usually used against bacteria, but people misuse it when they are suffering with a viral infection like a cold and flu. And antibiotics are given as growth promoters in animals and fish. This also caused antimicrobial resistance. Antimicrobial resistance threatening the ability to treat common infectious diseases, resulting in prolonged illness, disability and death. Scientists recently developed a protein which is called as epta protein that shields superbugs from antibiotics. It causes multi-drug resistance by masking bacteria from both the human immune system and important antibiotics. Zika virus or Zika fever. Zika virus is a mosquito-borne illness that is spread by Aedes species of mosquito, and this virus can cause birth defects such as microcephaly. This is the same mosquito that is responsible for the transmission of dengue and chikungunya. It is a flavivirus from Flaviviridae family. Transmission. Zika virus is spread by the Aedes albopictus, which is known as the Asian tiger mosquito, and the Aedes aegypti species. Spread by Aedes albopictus, which is known as the Asian tiger mosquito, and the Aedes aegypti species. The mosquito bites only in daytime. Evidence now shows that Zika infection can pass from a mother to fetus during pregnancy. It can also be transmitted through sexual contact or blood transfusions. Symptoms: fever, rashes, red eyes, joint pain, muscle pain, Guillain-Barré syndrome, and microcephaly. Guillain-Barré syndrome is a disorder in which the body's immune system attacks nerves, leading to muscle weakness and even paralysis, which is caused by bacterial or virus infection. Microcephaly is a condition in which an infant's head size is much smaller than that of others of the same age and sex. Zika virus is first identified in Uganda in 1947 and first isolated in 1947 from a rhesus macaque monkey that had been placed in a cage in the Zika forest of Uganda. But the first human cases are reported in Uganda and United Republic of Tanzania in 1952. The first outbreak outside of Africa and Asia occurred in the island of Yap in the Federated State of Micronesia. Later it appeared in French Polynesia. In 2015, the outbreak started in Brazil. First identified in Uganda, that is isolated from a rhesus macaque monkey in Zika forest. The first human cases are reported in Uganda and Tanzania. The first outbreak outside of Africa and Asia occurred in the island of Yap in the Federated State of Micronesia. Later in French Polynesia. And in 2015, the outbreak started in Brazil. Japanese encephalitis. Japanese encephalitis is a mosquito-borne flavivirus related to dengue, yellow fever, and West Nile viruses. The first case was reported in Japan, and the symptoms: mild fever and severe disease characterized by rapid onset of high fever. Japanese encephalitis is transmitted to humans through bites from infected mosquitoes of the Culex species. There is no antiviral treatment for patients with Japanese encephalitis. Treatment is supportive to relieve symptoms and stabilize the patient. Ebola. Ebola virus disease, also known as Ebola hemorrhagic fever or simply Ebola, is a viral hemorrhagic fever of humans and other primates caused by Ebola virus. The first case reported near Ebola river in Congo Bank. Ebola virus disease, it's also known as Ebola hemorrhagic fever, is a viral hemorrhagic fever of humans and other primates that is caused by virus Ebola. Hemorrhagic fever means the fever which causes bleeding. Symptoms, it's hemorrhagic fever which causes bleeding, gum bleeding, nose bleeding, fever, vomiting, diarrhea, rash, symptoms of impaired kidney and liver function. ELISA test or other antigen detection tests are needed to confirm Ebola. Fruit bats are considered to be natural hosts of this virus. Virus spread from animals like chimpanzees, gorilla, fruit bats, monkeys, forest antelope and porcupines found ill or dead to people. Human-to-human transmission through direct contact, physical contact or sexual contact with the blood, secretion, organs or other bodily fluids of infected people. Virus spread from primates like chimpanzees, gorilla, fruit bats found ill or dead to people, and the human-to-human transmission through direct contact. The most widespread outbreak was in West African countries, Guinea, Liberia and Sierra Leone. The first case reported in Guinea in 2013. The small outbreak were reported in Mali and Nigeria. United Kingdom, USA, Italy, St. and Spain are the other countries where isolated cases are reported. Swine flu, also known as the H1N1 virus, is a human disease caused by influenza viruses that infect the respiratory tract of pigs. Swine flu is also called as H1N1. Hemagglutinin type 1, neuraminidase type 1 is a human disease caused by influenza viruses that infect the respiratory tract of pigs. Symptoms of swine flu in human are similar to most influenza infections: fever, cough, nasal secretion, fatigue and headache. Transmission of the virus from pigs to human is not common. Swine influenza spread from person to person either by inhaling the virus or by touching the surface contaminated by the virus. The transmission of swine influenza from human to human either by inhaling the virus or by touching the surface contaminated with the virus. Bird flu or avian influenza. Bird flu or avian influenza is a viral infection spread from bird to bird. It can also spread to domestic poultry. It is an infectious viral disease of birds caused by strains of the influenza virus. Humans do not become easily infected with this virus, but human infection cases are reported.